So with artificial insemination, most of the time we're going to have the surrogate or the intended mother or trans male take some fertility medications so that 2 to 3 eggs will grow to maturity. You can do this without fertility medications if you're ovulating as well, and just do it with what we call monofollicular development. This is a single egg. But the process involves at the point of ovulation of doing an intrauterine insemination, also known as artificial insemination. And so the sperm is processed for the insemination process, and through a very simple technique, the sperm is introduced into the uterus. For those that are doing home inseminations, it's just placed inside the vagina. But from the medical practice, we place it directly inside the uterus. The sperm still needs to swim out the fallopian tube, fertilize the eggs, and the embryo come back into the uterus and implant. We have to look at, the suitability of this treatment option for those patients wishing to pursue this. We need a healthy uterus, decent egg quality, fallopian tubes that are open and functional. Also, I want to just speak briefly for those that are using sperm donors. Just like we talked about using known egg donors and anonymous egg donors, you can make these same decisions regarding sperm donors. So it could be a brother or a relative of a partner, it can be a friend. For those looking at co-parenting with another couple or individuals, it could be through that process as well. But just like with our egg donors and surrogates, if you're using a known person for your sperm donor, you really need to make sure you have a legal contract in place that protects your parentage and your rights moving forward. So the next slide here is actually showing how we process the sperm. So the sperm is we isolate the sperm from the ejaculate. So we wash it down, isolate the sperm, and then we use a technique called swim up, which isolates the sperm from all the other cells and debris within the ejaculate. This gives us the healthiest sperm to work with, and for those that are HIV positive or have infectious diseases, it helps isolate the infectious disease from the sperm sample that's used to inseminate the uterus with.